This is the interior of the right ventricle. Interior of the right ventricle presents a rough inflow tract and a smooth outflow tract. There is an angulation between the two tracts. So this is the inflow tract, this is the outflow tract. The acute angulation. To reduce the velocity of the blood which passes from the right atrium to right ventricle, the inflow tract is marked by roughness, and this roughness is produced by trabeculae carni. Trabeculae carni is a common term which includes ridges, bridges and pillars. Ridges are numerous muscular elevation throughout the ventricular wall. Out of these ridges, you should remember one ridge that intervenes between the outflow tract and inflow. There is outflow tract, there is inflow tract, in between it present a supraventricular crest. The supraventricular crest is an example of ridge. Now there are some bridges. Bridges are muscular thickening, cord-like, but two ends of the thickening are attached or fixed to the ventricular wall. An intermediate part is free. One of the very important bridges is the septomarginal trabecula. You must identify the structure. It is commonly asked in the examination, important for OSPE. So septomarginal trabecula gives passage to the right bundle branch. Right branch of the atrioventricular bundle. One end is attached to the interventricular septum, another is attached to the base of the anterior papillary muscle. So ridges, bridges and pillars. Pillars are the two papillary muscles. One is the anterior papillary muscle. The base of the anterior papillary muscle is attached to the sternocostal surface of the ventricle, whereas base of the posterior papillary muscle is attached to the diaphragmatic surface of the ventricle. Apical 1/3 of these two papillary muscles receives chordae tendineae. The chordae tendineae from anterior and posterior leaflet are attached to the anterior papillary muscle, whereas the chordae tendineae from the posterior and septal leaflets are attached to the septal posterior or inferior papillary muscle. In some cases, there may be some septal chordae. Now, smooth outflow tract is conical with truncated apex, and this outflow tract is known as the infundibulum. Infundibulum is conical with truncated apex, and apex of the infundibulum presents the annulus for the pulmonary valve. From this pulmonary opening, pulmonary trunk begins, and these semilunar valves are 3 in number, and these are the 3 semilunar folds. So these are more or less all about the right ventricle. So if you imagine the opposite side, the left ventricle, there is 2 valves. So mitral valve is also known as the bicuspid valve, and the outflow tract of the left ventricle is known as the aortic vestibule, and apex of the aortic vestibule is presents the aortic annulus and aortic valve, and from the aortic ascending aorta begins. Other features are more or less same, but you have to keep in mind that the wall thickness of the right ventricular wall is much less than that of left ventricular wall. So it is very difficult to demonstrate the interior of the left ventricle. So conventionally we study the right-sided heart. Thank you.